COVID-19. We've been fighting an enemy we cannot see. But with every punch, a new variant would arise, and its blows would prove to be devastating. Step by step, with every motion and movement of the virus, the Urban League of Greater Cleveland has stayed off the ropes and in the ring fighting for you. Through the Vax versus Variant campaign, we continue to share information to stay ahead of our next opponent. We've taken some hits as numbers increased, but our eyes remain focused on the prize. As we battle COVID-19, we remain strong, resilient, relentless, and tough like little giants. We will win.
You're watching Vaxxed versus Variants, an Urban League update and discussion. On last week's edition,
but you know, as a leader, we know that whenever there is a crisis, we are called often to be both an economic first responder and a health first responder, a social justice first responder. So in that first responder position, we have to do whatever it takes to get the word out, to get the message out, to use our influence, to reach in every portal that we can, to try to bring information, and just to make sure that we're connected. Sister Yolanda talked about the fact that working together, none of us can do this work alone. It takes the true village to really attack an issue like this. And I think when the end of the story is written, as you would often say, Sister Betty, we want to see that our name is in the chapter as one who helped to provide to this community for such a time as this.
Amen.
That was wonderful. Coming up next, we'll talk about health disparities and the role health disparities have played in communities of color. It's all coming up right after this.
I guess the importance of still getting vaccinated, even though I'm someone who was vaccinated, was supposed to get my booster shot the day that I found out I tested positive for COVID-19, is my symptoms compared to friends and family that had COVID before there was a vaccine was actually mild. From the horror stories that I heard, I had 2 rough days, and then after that, it felt very much like a regular cold. I definitely know that the vaccine helped to cause me not to have severe symptoms, and also helped the course of the virus to move through my body much more quickly than people who are unvaccinated. So it's still working. It's providing us the protection that we hope for, which is against death and serious illness, and that's what a vaccine does.
Health disparities refers to a situation where a certain segment of the population has a higher incidence and burden of certain diseases. Health disparities in African Americans are higher rates of high blood pressure, diabetes, heart disease, strokes, kidney disease. A number of cancers are more prevalent in Black populations. And collectively, these healthcare disparities result in a shorter life expectancy in Black men versus white men, Black women versus white females, and unfortunately we're talking even higher rates of mortality even in children of color.
One of the things that minority communities face as it pertains to like medical care is trust. There is a lot of mistrust of systems, and so people may delay going in to get care because they don't trust the system. They don't trust that they're going to be taken care of, you know, in a fair and equitable way.
And now, on top of that, you contract COVID. So the data shows that you may have a poorer outcome if you already have these pre-existing conditions and then contract COVID. So you look at that fact, and then you look at the fact that we're not getting the vaccine at rates as our Caucasian counterparts. Once again, yet another health and healthcare disparity.
If you have some type of underlying health condition, or you know that you will be around someone who has a compromised immune system, you want to ensure that you're taking those steps to protect yourself as well as your loved ones. And so what we want to do is we want to make sure that sometimes in some instances it makes sense to continue to social distance. It may make sense to continue to wear a mask, but we also know that the best defense is vaccination.
Almost any medical condition, there's not a reason to not get vaccinated. There's very few reasons why a healthcare provider would not recommend that for someone. Almost universally, they're going to recommend a vaccination. The other thing is of course to make sure that whatever your medical condition is, that you're getting the proper care for that too. Because if your blood pressure is under better control or you're in a better health status overall, then that can help if you do get sick to be able to get through it and bounce back, hopefully.
We're just trying to keep everyone safe. We're just trying to narrow these health disparities so we don't have to keep talking about them. That's my thing is this, I just hate talking about stuff. Let's do something. Let's do something. Let's get vaccinated. Let's not die of COVID. Let's just get out here. Let's take our medicine. Let's try to eat better. Let's exercise. We're trying to do our best to save people.
Welcome back to Vaxxed versus Variants, an Urban League update. We wanted to really touch base on the importance of understanding the role that health disparities have played in this crisis, and it truly is a crisis. Joining us in this segment, Dr. Latasha Jarrett. She's from the centers and she's the Chief Medical Officer. Also joining us is Dr. Charles Motlin. He's a staff urologist at Metro Health Systems and the Medical Director of Equity, Inclusion, and Diversity. Thanks for joining us on this edition of Vaxxed versus Variants. Let's get into it. Dr. Motlin, what can you say about that connection? We talked about statistics, we talked about how it's affecting people of color, but when you put in that whole piece, health disparities, what are we looking at?
Well, I think the health disparities are the overarching reason as to why more people of color, African Americans, Hispanic, Latinos, have suffered disproportionately from this COVID pandemic, COVID-19 pandemic. We've seen these statistics, and these statistics don't lie. I mean, African Americans develop or acquire the COVID virus about 3 to 5 times more likely than the majority population. We're hospitalized at twice the rate, and we actually have 2 to 3 times the incidence of death rates from the COVID-19 virus. And a lot of that is because of the existing chronic disease states that we most often see in minority populations. Some examples, higher rates of diabetes, hypertension, heart disease, kidney disease. All of these chronic diseases actually contribute to lowering our resting immune states and make us more susceptible to not only the COVID-19 virus, but the regular, yearly influenza. So we are more susceptible to infectious conditions such as the COVID-19, and then this is really underscores and it sheds light on the existence of health disparities that a lot of the population is not even aware of. We've spoken about it for a while, but we still need to spend more time educating the community about the existence of health disparities and the overall impact that it has on the shortened life expectancies in minority populations.
And you actually, Dr. Jarrett, was involved with a documentary sponsored by AARP. Talk to us a little bit about that, and we'll get back into the connection with COVID.
So I think that one of the things that minority communities face as it pertains to medical care is trust. There is a lot of mistrust of systems, and so people may delay going in to get care because they don't trust the system. They don't trust that they're going to be taken care of in a fair and equitable way. And so when they're faced with symptoms of COVID, their general fear, so they delay, where maybe before they got to the point where they had such low oxygenation or whatever, they just delayed. They tried to deal with it at home, or they're in situations where they're living in very close proximity to other individuals. So the difficulty with social distancing is great, or they don't have hospitals or medical facilities in their back door. So even just getting to them, even if it may be a couple of miles away, it may seem like they're traveling across country. So there's a lot of challenges. And as I said before, even when family members are thinking about, well, okay, if this person goes to the hospital, like, how are we gonna get back and forth to visit them? So all of these things really do, but I think at the crux of it is the fear and the lack of trust. So there's a lack of trust in systems. There's a lack of trust that people are actually being honest about what are the side effects of the vaccines? How is it tested? So there is just a lot of mistrust. And a lot of it is grounded in historical things that have proven to minority communities that they may not have always been treated as fair. And so it's real. And so there is going to be a lot of efforts that have to be made by the medical community to regain the trust.
And I think we've talked about that a little bit. Can you reiterate some of what she's saying about that and how Metro Health is tackling it?
No, I mean, it's a huge problem. And I think one thing for us as healthcare providers is that we need to project to the community that we understand their feelings, we understand the genesis for a lot of the distrust that is actually out there. You know, we have to demonstrate that we understand this so that we can develop trusting relationships, you know, with the community that are so desperately needed. You know, Metro Health has a number of programs designed to address a lot of the social determinants of health, and we do know that racism and race itself are components of social determinants of health and contribute to a lot of the healthcare disparities. You know, one program in particular that I'm proud to announce is our upcoming Minority Men's Health Fair, which is going to be held Thursday, April the 28th. Free health screenings for men of color. Actually, everybody is welcome, regardless of race or ethnicity, but we target men of color because we have seen that black men and black and brown men in particular oftentimes actually have higher levels of that distrust that we're speaking of. And again, it's due to a number of egregious actions that have occurred. You know, the Tuskegee, the infamous Tuskegee syphilis experiment, where nearly 800 black men who the Public Health Service knew that they had syphilis, but they deliberately denied treating these individuals because they wanted to, you know, study the natural consequences of untreated syphilis, even though there was a treatment available. This study started back in the 1930s and went all the way up unbelievably until 1972. So, and again, these are the reasons for the distrust. But at Metro Health, again, we're doing a number of programs. But the Minority Men's Health Fair, I encourage all the men to come in to undergo free screenings. We are actually administering the COVID vaccinations during the health fair. We're going to be at 3 simultaneous separate locations, our main campus. We're going to be at our Cleveland Heights campus and our Broadway campus. Again, free health screenings. We have about 400 healthcare providers already signed up to help these men, you know, when they come. We're providing health screenings from head to toe. So, you know, we're all about promoting the health of the community, and we understand the plight of you know, many people of color, and you know, we look like, you know, like we are people of color ourselves, you know, so you know, we've had certain lived experiences also. It doesn't matter that we have MD degrees, we've experienced, you know, racism, discrimination ourselves, so you know, we understand. So it's all about conveying to the community that we're here for them.
When you're thinking about Central and other communities, Fairfax or Glenville or Union Miles, there's a large concentration of African Americans as well as children. Does it concern you that our numbers are still low in pockets of our inner city where we have not been vaccinated? And what does that mean when a group of that magnitude aren't?
So it does concern me because, again, as we know, when you're looking at certain groups, even access to care, right? So you get sick, hospitals around you, facilities to take care of you, even the infrastructure with family members, are they in a position now if they have to care for you? So if they can't work, how does that impact? Everyone doesn't have an infrastructure in place where if mom is sick, I can take off from my job and I can come and see her. Or if you have to be hospitalized, how am I gonna get back and forth to the hospital if I can go? And if I'm sick and I have limitations with childcare, what does that mean? So all of those things have to be taken into account. And then when you look at, even when you just think about people in general, a lot of times as African Americans, we may have different experiences, irrespective of socioeconomic, when we step into certain arenas. We have different experiences. And so you don't want to be in a situation where you know that it is a virus this unknown. We know that the unvaccinated has a totally, in most cases, a much worse course than someone who is. And so then we know that we are still hoping in this country to have the same equality when different individuals step into the hospital, the quality of care, the seriousness that's taken about our medical conditions. We're still growing there. And you know, people are human, and you don't want to face that where people are kind of like, well, why didn't you get vaccinated? You know, and so it does worry me. It worries me because we've put a lot of effort, and we want people to reach out. If you're not sure, talk to us. And then in light of what we see now, with all of the isolation, we're seeing so many more individuals, whether they're adolescents, whether they're adults, who are facing issues as it pertains to mental health. It has just exacerbated that. And so we have to take into account that even as we're treating diabetes or hypertension, we need to ask questions about mental health as well.
There are resources out there for our mental well-being or mental health, and a lot of times, you know, physicians, we've ignored that aspect of the, you know, the total health of the individual. But again, I think since the COVID pandemic has arisen, I think we're more in tune with the importance of addressing, you know, mental health concerns. You know, one thing, we were talking about it earlier, one thing that is really distressing is the stresses and the social isolation that we've experienced during the COVID pandemic has even affected our children. We're seeing escalating, you know, an escalating incidence of even childhood suicide. You know, children as young as 5 years old, it's unbelievable. It's really alarming, and a lot of that is due to the social isolation that you know, we're experiencing. So we have to address the mental health component, and it's not just about, you know, manning up or being resilient. It's about addressing the total health of the individual.
We have been talking with Dr. Jarrett and Dr. Modlin about health disparities. Coming up, we're going to talk to a pediatrician from University Hospitals about vaccinations and also other COVID issues. More right after this.
COVID-19. We've been fighting an enemy we cannot see. But with every punch, a new variant would arise, and its blows would prove to be devastating. Step by step, with every motion and movement of the virus, the Urban League of Greater Cleveland has stayed off the ropes and in the ring fighting for you. Through the Vaxxed versus Variant campaign, we continue to share information to stay ahead of our next opponent. We've taken some hits as numbers increased, but our eyes remain focused on the prize. As we battle COVID-19, we remain strong, resilient, relentless, and tough like little giants. We will win.
Well, COVID is here to stay. So if people think it's going away, it's not going away. As you can see, there are new variants, and it's going to change. That's what viruses do. They mutate, they change. So it's not going away. Vaccines have changed medicine incredibly. You can't believe it. I mean, I tell people in the last 125 years, the two most important things for child health has been clean water and vaccines. And at the turn of the 20th century, 107 out of every 1,000 babies would die before their first birthday from vaccine-preventable diseases, from water contamination, and all just because we couldn't care for them either. Now it's 5 to 7 per 1,000 because babies who die now before a year of age are usually born too soon, too small, or have congenital defects that will not allow them to live. So people aren't afraid of the things that they used to be afraid of. And unfortunately, a lot of parents were vaccinated. I don't mean unfortunately, but they don't understand the importance of vaccine because they haven't had measles or chicken pox or mumps or recurrent otitis media infections that cause them to lose their hearing, the things that we used to see in child health. And so it's not scary, but it is scary to us in medicine. What we know is that vaccinations make a difference, that they do save lives, that they do minimize disease. And the science is why it's called science. It is based on actual fact and what people have learned over the years. You know, when I got my COVID vaccine, the first one, I didn't have any symptoms. The second one, oh, wow. I mean, I was fatigued and it was because the vaccine was working. When you get the second one, your body goes, whoo, I don't like that. And it attacks the COVID that you got as the vaccine. That means it's working. With the booster, there was nothing. So herd immunity, it's H-E-R-D, and it means like a herd of cattle, okay? And so if my child's vaccinated, your child's vaccinated, the kid across the street is vaccinated, that disease probably isn't going to be in our community. But when you have a low vaccination rate, those diseases can come back in. And remember, we're an international country. People come from all over the world. They had an outbreak in Columbus because they had people who came to go to college and brought diseases from other parts of the world. So it is very important. You get down to a certain level, and then the disease is going to be reintroduced into the population. What we're concerned about now is we don't have enough people vaccinated, and so the herd immunity is not there. So I say to people, you can't go back to the way it was. You need to wear your mask, keep your distance. One of the things that people don't realize is when you aren't immunized or your children aren't immunized, you put all of the older people in your family at risk. And do you really want grandma to get something because she may be immunocompromised, she may have diabetes, she may be on some chemotherapy. And so I tell people, if you have a new baby and people want to come see them, you show the baby through the front door, window, or through the window. No, you can't come in, and especially if you're not vaccinated. But why would you risk it when you don't have to?
As a mother and a grandmother, I totally understand the thought process that has to go forward when deciding, do we get our children vaccinated? I am sure that it's the same process that my parents went through when there was the polio vaccine, when there were smallpox vaccines, because they thought about the fact, I don't want my child to get sick, and I want my child to live. Those were the primary drivers in their decisions. But now we have one more factor to add, and that is we also don't want our children to be passing on the virus to others. And so we know that getting our children vaccinated is not only a safety precaution for them, but it is also for the whole family. And so that's why I'm a strong advocate. I say talk to your pediatricians. Make sure you're taking your children to get vaccinated at a place that they're comfortable and you're comfortable, because that makes a difference. But the bottom line is, let's get our children vaccinated.
Welcome back to Vaxxed versus Variants, an Urban League update. Coming up, how some school districts tackled COVID-19 while educating its students. Thanks for watching.